Hi, I'm Dr. Cheruba Prabakar, a board-certified OBGYN and fellowship-trained minimally invasive surgeon. And today I'm going to discuss the treatment of fibroids. I'm going to spill all the gems on if you should treat a fibroid, when you should treat a fibroid, and how you should treat a fibroid. So let's get started. Now, if you're like most people, you figured out that you're a fibroid two ways. Either someone was doing a scan for something else and they saw that you had a fibroid and said, hey, you have a fibroid. Or you actually had symptoms such as bleeding, pain, you felt like your belly was getting bigger, or you saw a bulge in your belly, or you have not been able to get pregnant for a long time. And your doctor then ordered some imaging and then figured out you had a fibroid. So regardless of how you got the information, what do you do about it? So the first thing to consider is you don't have to do anything. If fibroids are not bothering you, they can just be observed. So that's an important thing to remember. You don't have to do anything. Secondly, if you are having the symptoms that I discussed, bleeding, pain, infertility, well, then there are several treatment options for each of those categories. So let's break it down. If you are suffering from heavy bleeding because of fibroids, you can then treat that with birth control pills. You can treat it with a progesterone-containing IUD like a Mirena or a Skyla. You can treat that with a Nexplanon, which is a little rod that goes in your arm that helps with bleeding. You can treat it with the NuvaRing or the Annovera, which are vaginal rings that can be used to help with bleeding. And if you're done with childbearing, you can also consider a uterine endometrial ablation, which is a procedure where we circulate really hot water into the cavity of the uterus to char or burn the uterus. So these are some options for treatment for just the bleeding. Now, if you're somebody who's suffering from bulk symptoms, such as pain, and you feel your belly is getting bigger and you feel this mass in your belly, then you're gonna wanna shrink it or get rid of it. So the options there are using an injection called Lupron, which will shrink the fibroids, or you can use a procedure called a uterine artery embolization. This is something that is done by an interventional radiologist, and it's a procedure where they shoot up these little pellets into your uterine artery, and it cuts off blood supply to your uterus and the fibroids, and it helps shrink the fibroids, and your uterus just expels this material over a couple of weeks. So these are two other approaches that you can take just to shrink the fibroid. Now, if you want to get rid of it, then I would suggest a myomectomy, which is a procedure where you can actually remove the fibroid. And this is done via a robotic approach, a laparoscopic approach, or if you have a lot of fibroids or they're very big, then you're going to want to proceed with a laparotomy, or where the incision is more like a C-section incision. So that's to take care of the bulk symptoms. Now, if you're somebody who has been having issues with fertility and then it's found out that you have a fibroid, you definitely want to remove this in order to be able to conceive and then carry a pregnancy successfully. So when we talk about fertility and fibroids, location is paramount on how we treat it. So if your fibroid is inside the cavity of the uterus, well, that can actually affect implantation. And so the quickest and most efficient and thorough way to treat that is by actually a procedure called a hysteroscopy, where you put a camera into the cervix and into the uterine cavity to shave off that fibroid. Now, if you have larger fibroids or many fibroids, then you want to proceed with a myomectomy that I just discussed before. So removing the fibroids via robotic or laparoscopic surgery if there are a few of them, or via a laparotomy if there are many, or if the fibroid is just too large. Now, if you have tried many of these procedures or treatment options, or if fertility is no longer a concern, or if you have other medical reasons why you can't really be on hormonal medications that I discussed in the beginning of this video, then at that point, you may be a candidate for a hysterectomy, which is removing the fibroids and the uterus. A hysterectomy means removing the fibroids of the uterus. It does not mean removing your ovaries. So you don't have to worry about that. You still have your hormones from your ovaries, but you may want to consider hysterectomy. So removing the uterus, the fibroids, plus or minus the cervix. There are benefits to that. And discuss that with your doctor regarding the risks and benefits of keeping versus removing the cervix. But this procedure, again, can be done laparoscopically, robotically, or via a laparotomy incision, and it'll all depend on the location of the fibroids, the size of the fibroids, and the number of fibroids. So that is essentially a synopsis of the medical and surgical treatment for fibroids. Now, I want to mention one thing before we end, and that is lifestyle modifications. So if you're somebody who is not really having a lot of these symptoms, or you're not in an urgency to have them removed for fertility reasons, I definitely suggest switching to a plant-based diet and trying to get rid of inflammatory foods. So there have been some studies that have shown that cruciferous vegetables such as broccoli and cauliflower help prevent recurrence and growth of fibroids. There's a lot of research being done on this, but certainly the way we live our lives with our diet, exercise, and how we take care of our bodies can also impact fibroid growth and regrowth. So that's something you definitely also want to keep in mind. So I hope that has been useful, and we'll see you next.